The Clinical Genomics program is an exciting new collaboration between Stanford Children's Health and Stanford Healthcare. It brings the technology of genomics to the bedside of our patients. In essence, we are trying to solve the hardest cases in medicine.
The Clinical Genomics program will allow us to make diagnoses that we were never able to make before. I saw a patient today in clinic, and after 2 years, we were able to tell the family the underlying cause for their child's findings.
The promise of genomic sequencing is particularly acute for those who've been on a medical odyssey. Those who have suffered from undiagnosed disease. Maybe they've been to one doctor after another. Maybe they've had one test after another, and haven't yet found the answer. And without the answer, of course, there is no treatment. One of the things that whole genome or whole exome sequencing can bring to those individuals is finally an answer.
Why they might have had epilepsy, why they might have had a congenital heart defect. Having a specific genetic answer allows us to tell them what to expect for their child or family member in the future.
One of the incredible things about genome sequencing is that it's not really just a test for today. Every single day, every single week, every single month, we're learning new information about the association between genes and genetic variants and disease.
After a patient has had their blood drawn, that sequencing data is available virtually forever. And so without drawing another blood sample, at a certain point in time, we can go back and reanalyze the sequencing data to see if we have another answer.
This is a complicated test. It starts with taking a DNA sample, a blood sample, sending the sample away, getting every single letter of every single gene spelled out. And that's a lot of data. Then interpreting it is another really important part. And there are many decisions to be made in the interpretation of that data. Bringing that team close by, close to the patient, is really important, because so that those decisions that are made can be followed all the way through to the physician and the medical team looking after the patient. One of the critical aspects of sequencing the genome and learning about new genes is that we can solve the condition not only for the patient in front of us, but potentially help patients around the world. This improves medical knowledge, improves our knowledge of genes and how they cause disease, and moves forward the whole field.